Get ready to fall back. Daylight saving time comes to an end on Sunday, and aside from that extra hour of sleep, what effect does the time change have on our health?
Sleep disturbance is one of the major risk factors for cardiovascular disease. It can impact your blood pressure, your heart rate, and overall heart health.
This is the Fox News Rundown Evening Edition. Get ready to reset the clock on the microwave again. Daylight saving time ends on Sunday. Daylight saving time is the period between March and November when most of the U.S. sets their clocks forward by an hour. That's why we gain more daylight in the summer evenings. But when we fall back in November, it adds more daylight in the mornings. It's a schedule change that takes a little getting used to. But could it also affect our health?
Anytime there's sleep disturbance, it can have an impact on our health, especially our cardiovascular health.
Dr. Fahmi Farah is a cardiologist with Bentley Heart in Fort Worth, Texas.
And the how part, it more has to do with the circadian rhythm. So once our circadian rhythm is what determines how our sleep pattern is. And if that's disrupted, we may lose sleep. And sleep disturbance is one of the major risk factors for cardiovascular disease. It can impact your blood pressure, your heart rate, and overall heart health.
Let's say we're changing our clocks as we do. We get an extra hour of sleep, supposedly, this weekend. Is there something that we should watch for as far as, any studies that have been done or research that's out there that says, okay, here's some people are with facts and figures to kind of explain things to them. Do you know of any kind of research that backs this up?
Certainly there's been research done on sleep disturbance itself, and that's how American Heart Association has now labeled it as a major risk factor for cardiovascular disease. As far as losing this 1 hour of sleep versus gaining it, whether that has a direct impact or not, I do believe there needs to be more studies done for us to be, find any direct correlation. But as far as other correlations go, we do know that sleep is a major risk factor.
What effect does this have on our mental wellness as well? I know you're a cardiologist, you're not a psychologist, but it seems like a lot of people really dislike, especially the winter months after November when we fall back and then we end up, with darkness earlier in the afternoon. After we come home from work if we get off at 5 and we're coming home from work, it's already been dark for a while. What effect does that have on activity that we would normally do and our overall, mental well-being of, wow, it's just dark all the time?
I'm so glad you asked that question. It's actually profound, the effect. Psychology, psychiatry, and cardiology and your cardiac health are very much related. So when we lose, this time we're gaining an hour, but aside from that, the impact it has on that daylight saving is huge, especially for people who are going into work early and coming out late in the day, like myself, for example, healthcare providers. They really lose that exposure to sunlight, and sunlight is so important for mental health. It does drive the rate of depression and mental health higher during the winter months, especially in regions like, Seattle and places like that. It's the same here, even in Dallas, for someone like myself and other healthcare workers. They're very much victims of this because heart health and your psychiatry, like mental illness, depression, they're very much related. As you mentioned, important to note that people do let go of their healthy habits because they're getting out when they would be going out to run during daytime. They don't have that. And when you're feeling depressed, your healthy habits kind of naturally tend to go away. You don't have the motivation to eat healthy. So it's a multifactorial effect that it can have on your overall health.
What advice do you have for people who are concerned about that? I know we've heard of seasonal affective depression. I believe that's what it's called, disorder. This is one of those things that, a lot of people talk about, especially during the winter months. What advice do you give to people who are struggling to, get that circadian rhythm, back on track and, kind of ward off some of these things that we've been talking about that are detractors to your health?
Of course. So in order to not get the full impact on your circadian rhythm as a result of that 1 hour change, I advise people to start a little bit earlier, like in increments of 15 minutes a day, a few days earlier, so that by the time the change actually takes place, your circadian rhythm is not affected. It doesn't feel the impact of it. So your sleep remains intact and you don't get any kind of sleep disturbance as a result of that. As far as warding off some of the other impact of losing the daylight as a result of, not being getting that exposure, I would say really stay mindful. Light therapy is very important. So you can even light candles, make sure you're well lit. And during daytime at work, for those who are working indoors, like hospital workers, make sure during your lunch break, try to get out there and take a walk. Even if it's a 10-minute walk, that exposure can really help prevent some of the worsening symptoms of depression. And then making sure you're staying connected with your friends and loved ones, making sure you're maintaining a healthy routine of exercising, even if it is indoors, and eating healthy. All of those would go a long way.
I also want to ask you about the effect of all of this, especially the sleep, which we keep going back to. And sleep is obviously extremely important. As you mentioned, it affects so many other things and can lead to adverse effects if you don't get enough of it. How does this also affect your immune system?
It does affect your immune system, yes. Sleep is when it's our natural way of recovery. That's when, damaged cells are repairing themselves. Our blood vessels are repairing themselves. So while we are sleeping, our body's really at work. It works to repair. And when we're not getting adequate sleep, we're not allowing our body to heal and get time to have some of those essential repairments. And so, yes, it can have a detrimental impact on your immune system by reducing your immune response. A lot of times people who have lack of sleep as a result of the lack of immune response, they can be more exposed or rather more susceptible to illnesses like viral illness and things like that during the winter months.
We've been speaking with Dr. Fahmi Farah. More after this. I know we see a lot about, wellness and self-care and things like that. Does something like meditation have a good role or a role to play in all of this, especially when you're dealing with sleep? Maybe you can't sleep as well, whatever is going on in your life, it's keeping you awake at night, could be tons of different things. How is that something that would help people, kind of combat this?
Absolutely. Meditation is very, very helpful and has a really big positive impact on your overall health. It's the whole mind, body, soul. I do believe that everything's connected, and meditation helps you to relax. Stress is another component to this. That's a driving force. That's an underlying risk factor to many, many things like cardiovascular diseases. So mitigating that through meditation is a great, great source. It helps to relax. It helps to focus. So yes, I think that meditation helps mitigate a lot of this.
You mentioned some, workers who go like you had the perfect example of especially healthcare workers who work, long days, 12-hour shifts sometimes, all kinds of different schedules like that. And not just them, but, all kinds of workers who have those long shifts, and you're going to work in the dark and you're coming home in the dark. I can only imagine, what has that been like for you personally? I mean, like when you have to find yourself in one of these long scheduled days, how does that affect you, and how does that transfer over into what you tell your patients?
Personally speaking, it does have a huge impact during the winter months, especially when you have long shifts. There have been times, and especially going through my training years, we used to have 72-hour shifts, and when you're just in the hospital and you're just not seeing any daylight, and it can have a huge impact, especially during the winter months. On that note, a lot of times healthcare workers, they're on call, especially on holidays like Christmas. I remember many times being in the hospital on Christmas Eve. It can get very depressing when you're away, not seeing sunlight, when you're away from your loved ones, not getting to celebrate that special night. So it's hard. It gets very hard. And so I suggest, from my personal note, trying to talk to your friends, stay in close connection with your family during those months. Candlelight is a huge therapy for me, because it really helps me feel like this warmth, and it just instantly lifts your mood and makes you feel like, like you're surrounded by people, like that nostalgia. So whatever you remember, like memories of good things that brings up your mood, makes you feel better, I would say employ all of those during those months when it gets difficult.
When you see patients who come in, especially during the winter months, is it ever one of those things where you're like, okay, let's talk about the sleep. Let's talk about, the amount of daylight you're getting. Do you ever hear from patients who are really struggling in that area and it's affecting their overall health? And it kind of stems not only from this, but a lack of sleep, a lack of daylight, that kind of stuff.
I do actually, yes. It's especially a problem during winter months. I have, a lot of times patients don't come out and say it directly, like, "Hey, doc, I'm depressed. That's the reason why I'm not coming to see you." Or, compliance goes down during this time of the year as well, because some people are very much lonely. They're at home alone and they're not getting that daylight, and it's just a compounding factor to their mental health, and they'll stop taking medications and stop showing up to their appointments. So yes, I do have these conversations regularly with some of my patients.
What's the thing that you tell them, the easiest thing for them to do? Like if somebody's listening to us today and they're like, "Yep, I know this is what's coming for me. This happens every year. The darkness it seems to kind of envelop everything, not just the outside." What do you tell them that's maybe one simple thing that they can take away from this to do to help them?
I would say take every season and enjoy that season and bring out the most positive of that season. If we lived in the spring at all times, we would lose the beauty of spring. So we gotta see the beauty in each season. Winter is hard, but what I tell people is relate to everything that you enjoy. Bring out the warmth, bring out the candle lights, and watch the movies that you enjoy the most. Like Christmas time is such a beautiful time. Put on lights, bring out the warm comforters, the blankets. So whatever it is that gets you going, and your health and your mind and your body, focus on that. So long story short, I tell everybody to focus on the positives and exercise gratitude.
Dr. Fahmi Farah is a cardiologist with Bentley Heart in Fort Worth, Texas. Thank you for joining the Fox News Rundown Evening Edition.
Thank you for having me. It was my pleasure.